Thank you. Got it. Yeah. Hello, guys. Tonight is medical night. So just for our new friends who just join us, we usually have a cycle of study, and I specialize in three topics, three areas of study. One is the academics on the ancient Chinese culture. Right. The second one, obviously, specialize a few in the martial arts side. And the third one, obviously, is the medical side. And tonight I use three patients interviews. I captured 28 years of clinical case studies, because everybody can talk about it, but at the end of the day, it would be, the essential to obviously, especially in the university, when I teach in all the university, you need to provide clinical case study. The patient tonight, we filmed it quite a while ago now, back in 1996, as quite a while ago, some of the film. Okay, so now, before I start, can we give us the board, please, controller? Can you kindly please take a picture of this board? Because later on, when the camera moves away, you might not see the board very clear. So you can look at your own phone, and also you can file it. So at least, you kept some records of what this lecture is about. Okay, yeah. So I'll give a few seconds. People try to get out the phone and try to take a picture of this. Okay, yeah. Okay, we're in 4 parts. I got 3 patients. I'll take out all the old clinical case studies. So each one I try to use the interviews, right? And then we try to analyze what's happening there, all right, from the medical point of view. And then finally, the conclusion, if people want to ask some question, I'll try to answer it. Okay, yeah, good. Now, next picture, please. Okay, obviously this myself, that was quite a while ago now, 2012. And it took me 7 years to do this, my PhD, because I have 28 years of clinical case study to put it actually back into the dissertation, so I have to put it all together. So it took me longer than other candidates. Usually it's 3 to 5, but my one took me 7 years. Almost got chucked out, because in China, if you cannot do it in number 8 years, the 8 years, you'll be disqualified. So I'll rush it in to do 7 years. Okay, so next picture, please. This is the University Hospital, Shandong, and myself. And right next to gentleman next to me is my supervisor, Professor Jensen. And opposite, these are other professors of the hospital, because I'm from Shandong University, and these are the University Hospital. So a lot of time we work together for my research in the internal Taoist medicine, okay? Because a lot of people never even heard of it. So a lot of people were mistaking that these are all fake things and fake news and this and that. So that's why I have to show people, all the relevant materials, okay? All right, next picture, please. Okay, Nancy, can you please play the short film, and then Paul can take over. Thank you.
I had arthritis for a really long time, since I was 17. And the first couple of times we did it, I got into it fairly quickly, and afterwards we felt so kind of clear, and everything felt really sharp, and it was almost as if you'd had your brain washed out with soap and water, and you walked outside feeling really, gosh, everything's clear again, felt really healthy. Training, you're actually strengthening the internal ligaments, and that's been incredibly good for my joints, and I don't get arthritis at all anymore. All
right, can you give me the picture now, please? We can analyze a little bit on this short film, Paul. Obviously, this lady's left back in 1996, because the earliest record I captured on film is 1993. So it's about 28 years ago. So that's quite a while now, yeah. That's why we have to understand that, because this internal Taoist medicine is quite, shall we say, a strange affair. You can see people convulsions and the emotional burst. So a lot of people are frightened of it. And that's why a lot of the time they've been pushed behind to spiritualism, you know, so people cannot understand what happens. So a lot of time they've been pushed behind spiritualism. Okay, so as a medical research, doctors and the professors, and I could only help you to understand what happened, how this self-healing property of a human body, mind and body happens through human science. Okay, yeah. So that's why let's analyzing it. Okay, now everybody heard the ladies, they have arthritis since she was 17. So so it must be suffering for quite a while now. Yeah. So now this patient I use is the spontaneous reaction, because remember there are two therapies. One is spontaneous, which is subconsciously controlled, right? And the other one is conscious methodology, 功法 the exercises. So tonight I'm choosing this spontaneous side. Okay, yeah. All right, next picture, please. Okay, now I just extract the pictures out from the film. Okay, yeah. You can see that's my old school back in the 90s. At the back of it, you can, on the right hand side, you see some wooden dummies, and one of them, the head got kicked off as well. So because that's as we train martial arts, you know. So anyway, so and I energize the lady, and that's what happened. Next picture, please. So now it's a bit blurry, but you can see that her reaction just now you saw the film. So it is quite very, very, shall we say, quite a powerful reaction as well. All right, next picture, please. He was having a fits, all right, on the floor. Okay, yeah. So next picture, please. Okay, go back to the other one. Okay, now, can you give me the big frame, please, Paul? And I can use this. Okay, okay. Now, so what happened is, right, you saw the picture, so you saw the film. So this 15 minutes, what I'm trying to say is, right now, the patient won the A interview. Okay, now, before that, I say, obviously, the Shandong University, the topic of that talk at those times, we called it the Qi, the blockages. Okay, so I'm using the blockages, right? What are the blockages? Because obviously, from the arthritis and rheumatism, because different medical studies and different physicians and doctors, you know, we have all our own diagnosis methodologies, and we have all our own different tools to use it. Okay, yeah. So, however, in the internal Taoist medicine, we have this theory called blockages, and also we have the Qi, the energy blockages. Obviously, sound very, very unusual to outsiders. So I just want to use this, right, to analyze how we look at I look at my patients, right, 28 years through, you know, symptom like arthritis and rheumatism. So the patient's interview. Now we can see that when I energize, I use the word energize. Now these are very special term. Other obviously medicine study, they don't have it, because this is the internal Taoist medicine method. We're using energy. So I'm using my energy to trigger, right, my patients and let her body react. Now, I don't heal anybody. Okay. In fact, you know, I mean, nobody heal anybody on this planet. Is the patient themselves. It's a self-healing thing. So we can only say that we are on the outside, right? Yeah. We stimulate them. So if a doctor, why the Western medicine, they use medication as a stimulation. The Chinese using TCM, the herbal remedy, as a stimulation. So it's the medication that go inside to the body, and there's some reactions. Everything is 50% of, shall we say, 50% of successful rate and 50% of failing rate, because that's the law of the universe. Everything is only a 50-50 chances. So Now, obviously, we're not only looking at the failing side, right? Now, we're not looking at the successful side because it's successful, but we're looking at the failure side as well. So that's the Taoist principle. Okay, so when the medication, external stimulation, I use the word stimulation to go inside the body, something happened. And obviously something has happened. But although it looked weird, and a lot of people will laugh about it. Now, there is a lot of fake news and fake films out, in the YouTube, especially a lot in China. Okay, so that's why, you cannot blame those people, because there are a lot of unqualified masters that are playing around with it. So that's why we use in the university, we can only justify it to use actually a clinical case study. And you can see in most of my film, I've got consent, and I usually got interviews from the patients, so allowing them to express. So that means, to justify that, okay, yeah, it's not, it has happened. So from a research fellows, what has happened? Why did it happen? And how did it happen? So this is, from that point of view, I like you guys to follow me, right? If you like all these spiritual things, and like I said, you come to the wrong teachers, all right? You got to go where the spiritual teachers are, right? Yeah, okay. So from here, what happened is the blockages. So from our internal Taoist medicine, okay, now the brainwave can be, measured as the subconsciousness, right? Yeah, so we can talk about that in next session. I've spoken about it as well, because the subconsciousness is the brainwave change, right? From beta to alpha, alpha to theta, and theta to delta, right? So the patient brainwaves have flipped, right? From fully conscious, right? From fully consciousness to semi-consciousness. So that's why you can see, she's drifting out of consciousness. Sometimes she's fine, sometimes she's gone down. And then finally, usually you shut down. When you shut down, it can become delta, completely unconscious. And that's the time that the natural body medicine come out. So we can look at it from that point of view. Why? Because all the natural body medicine inside the body, okay, yeah, react to my stimulation of my energy, right? That means my energy field, I trigger her endocrine system to open up. That's what Qigong is about. That's what all the, if you want to call it spontaneous Qigong, you call it Qigong healing or spiritual healing, or even, placebo effect or meditations and all this. That's what happened is, can the stimulation on the outside, different methodology, trigger your endocrine system? Because the glands, now the Nei Dan, we talk it, the Nei Dan, the internal Taoist medicine, the term is actually today can be testified with using hormones, the words hormones and biochemical reaction inside our body. Because we know now the hormone can regulate our physical and psychological health issue. Too much hormone, you're ill. Insufficient hormone, yes, a different term is, can we assess it, adjusting it? So if it balance the health status of that particular organs, right, is healthy. So this is how you have to look at it through the internal Taoist medicine. And obviously the hormone came through the glands, and the glands have different glands. That's why we have upper dantian, we have middle dantian and lower dantian. And the dantian is not one point. The dantian is an area. So if we're looking at this is the master glands here, the two master glands. Now, the ancient called it Lai Yun here, earth tablets, okay? So now anatomy, we know that just different names. It's the pituitary glands, master glands. And also the ancient Chinese call this the jade palace, okay? So now today we know it's a pineal gland. Now these are the two master glands, and all these glands, like thyroid, parathyroids, and the rest of the glands, if they don't activate enough, the glands not opening up, the natural body medicine or the hormone will not release. So you have to look at it from that point. So now the blockages, why? What do you mean by blockages, right? So the blockages in the internal Taoist medicine, right? We have biochemical blockages, musculoskeletal blockages and also neurological blockages. Now we talk about qi, the energy. So how can we put that into, our understanding of, shall we say, from the medical point of view? Now, so if we look at the biochemical blockages, that means if we look at the meridian side, okay, the meridian side is the meridian is actually a network of depressurizing system for our organs. And in Taoist medicine, we have 14 major organs instead of 12, because we also count the spine and our brain. Okay, and because these regulations are blocked, disrupted or imbalanced. Okay, so the naidan, we call it naidan, or the hormones, which offers just now saying, the glands, right, that doesn't open. So these biochemical reaction or biochemical natural body medicine doesn't really, come out enough or insufficient or excessive, imbalance the whole thing. So something has blocked it. Something has stopped it. Shall we say, the regularity, right? The normal secretion of those, because the body all the time try to balance itself. That's why it's self-healing. But anything that in excessive or insufficient, the particular organ will be ill, right? So this is why we call biochemical blockages. Usually it's going through, the meridian things, right? Yeah. And from here, also the musculoskeletal and this stuff, because sometime now about especially the joints and all the joint, that's why arthritis, all the joint, because it's, the blockages, the muscle die or the cell die and they really squeeze it in. So it becomes hard, piles and piles, so swelling up and all the joints and things. Yeah. So that's why we have to use methodologies. You can use Tui La, we call Tui La, and in bone setting, because I've taught in quite a number of faculties of physiotherapists in different university. Today you call it massage or manipulations. Okay, so these are musculoskeletal blockages. Okay, yeah. So at the end is neurological. So how come neurological comes in? Because the pain, because when these musculoskeletal, just when the cell die, right, muscle shrink, and when the muscle shrinking is squeezing, and obviously it just squeezing into like even put great pressure on your the blood vessels, and also don't forget there are loads of nerve ending, right, distribute among all the musculoskeletal layers. So when these become like gripping onto it, of course they could become painful, because you trigger the neurological, the response. So you have in our training, we have pain, sensation of pain, sensation before the sensation of pain is itchy. In a minute, second patient, you'll see a really itchy. You can see in like millions of ends all over the body, that kind of reaction. Yeah. So that's why we have to first understand what we're talking about, blockages, the qi. Okay. Yeah. Now, okay, mark it, please, and then start recording again.